Hello everyone, my name is Brittany Looney. This is my PowerPoint for this Role of Nurse Leader Part 2 project for NURS624. With this project and this PowerPoint, I focused on the use of standard precautions in healthcare. I apologize in advance if you hear my baby kind of grunting or crying or coughing in the background. She's fighting quite the cold and is not quite happy to be anywhere other than right in my lap. So please bear with me and enjoy my PowerPoint. Thank you. This project focuses on the use of standard precautions in healthcare today. So the focus of the project is identifying this as a quality issue. And first and foremost, you ask, why is this a quality issue? The reason behind that is that patients and employees are at risk for acquiring illnesses or other chronic infections through the inappropriate or inadequate use of standard precautions. This not only has the potential to create a negative outcome for a patient, but it could also affect an employee in a negative light. What are standard precautions and what's the point of them? Typically, this is a universal protocol throughout all healthcare organizations. First and foremost, hand hygiene. Diligent hand hygiene, including washing of hands or the use of hand sanitizer. Secondly is the use of personal protective equipment. That includes gowns, masks, goggles, but most importantly, gloves. And last but not least, as identified by the World Health Organization, the other portion of standard precautions is respiratory hygiene or cough etiquette. All three of these things combined are meant to reduce the risk of transmission of bloodborne pathogens as well as any other type of illness, really, not just bloodborne pathogens, but any type of virus, bacteria, essentially any germs. It's helped to try to alleviate the risk of acquiring these. One issue that I've noticed in my nursing practice is that when nurses in the emergency department that I work in administer injectable insulin, they're not using gloves, which is foreign. It sounds so foreign to me, but it's happening, and it's happening pretty often. When told, if you just ask the nurses that I work with, they identify with several things that are also listed in a recent study published, and they cite several things as the reasoning behind not wearing gloves. One of which is lack of time, one of which is not having gloves easily accessible, and last but not least, just saying that they forget, that they get in a rush, and they just forget. The World Health Organization identifies 2 recommendations based on evidence-based practice to help with the use of standard precautions and to focus on when using the standard precautions as an employee in healthcare. The first is diligent hand hygiene. The second is consistent personal protective equipment use when indicated. Hand hygiene is something that is so important as nurses that we perform correctly. It may be seen as minimal or not as important as you're getting high acuity patients and trying to perform 100 things in a short amount of time, but it truly is very, very important. The World Health Organization recommends one of 2 types of hand hygiene. The first is hand washing. They recommend that you wash your hands for 40 to 60 seconds by applying soap, rubbing all the surfaces, and then using a single-use towel to dry. The second is with hand rubbing alcohol-based cleaning product, and they recommend that you utilize that for 20 to 30 seconds, and you apply enough to cover all areas of your hands, and then rub until dry. They identify hand hygiene as being needed in several different instances, which truly should seem like basic nursing care. But the World Health Organization says that hand hygiene in some fashion, whether it's hand washing or hand rubbing, should be performed before or after any direct patient contact or between patients, whether or not gloves are used. Also, immediately after gloves are removed and after touching any bodily fluids, or even if gloves are utilized. The use of personal protective equipment is another recommendation by the World Health Organization in a way to maintain adequate standard precautions in healthcare. They divide this into 3 separate portions. The first is to wear gloves or to don gloves. The second is to provide or wear facial protection. And last but not least is to wear a gown. With gloves, they recommend that you wear gloves during all aspects of patient care where you would be touching bodily fluids, mucous membranes, or skin that is not securely intact. Also, it's recommended that you change your gloves between tasks and procedures on the same patient if you come in contact with material or bodily fluids. And last, the World Health Organization says that we must perform hand hygiene immediately after removing gloves. Facial protection can be one of 2 fashions. The first is a surgical mask or eye protection like goggles, and the last is a face shield. Oftentimes, at least in the facility that I work in, they come with the suture kit or the suture laceration kit and tray that we utilize for wounds automatically, so that we're able to use those and have them available and easily accessible in case they may be needed. Last is a gown, also is often included in our incision and drain kits that we use in the facility that I work in. But the World Health Organization says that you should use a gown if you're suspected that you may soil clothing during activities, meaning if they produce any type of splash or spray of secretion. The current interventions that are being performed at the facility that I work in are twofold. The first is annual education with continuing education, and often it's in terms of online courses and tests or quizzes and review of information. The second is annual performance competencies. These are actual competencies that we must be checked off on by one of the preceptors or by one of the charge nurses to show that we're performing appropriately. The use of standard precautions is included in both of these, both the continuing education and the annual competencies. My recommendation for making a change and improving the use of standard precautions, especially in administering injectable medications such as insulin at the bedside, is to utilize a buddy system between 2 different staff members. And what this would do is this would, number one, it would call for 2 staff nurses or 2 staff members to be at the bedside and actually ensuring that the procedure is being performed correctly, meaning that if one nurse chooses not to wear gloves or forgets, then the second nurse is able to immediately be accessible and to say, hey, hey, grab some gloves really quick before we administer this insulin. Essentially, they're able to remind one another of the use of proper PPE. One tip or suggestion for actually the implementation of this is to have a electronic login once you scan the medication. At the hospital that I work in, you have to have 2 nurses actually witness and verify that insulin is the correct amount. And so what you're sometimes able to do is to not actually do that at the bedside. But my recommendation would be to create a way or an automatic pop-up, such as requiring a witness, that would allow for the PPE to be accurately used at the bedside. As with any new process, there's bound to be some trials and tribulations with the new method that I've proposed. One is that what risks would your team face if the method was utilized? Number one, if the unit is short-staffed, then they may not be able to perform the buddy system. Another situation that would have to be thought of is if there is a code situation or a medical emergency. Is there some type of system override that's able to be performed so that there's no delay in patient care? Mitigating risks. As a nurse leader, I would work with information services to ensure that there was a system override for a true medical emergency, because that is kind of the key thing that I would be concerned about, is that if there were a medical emergency or a code situation, what the plan for quickly resolving that issue would be. Handling any errors that occurred. Performing medication error reporting would continue as normal. That is performed on a routine basis at most facilities, especially the one that I work on or with. And another way that I think would be good to handle or to monitor errors that are occurring or inadequacies in the buddy system are to perform unannounced real-time audits of employee performance and compliance to ensure that people are truly doing the process accurately and it's benefiting patient care. In order to monitor an improvement and to make improvements and truly monitor the progress of the system, I think it would be an ideal situation to create a committee within the unit that monitors the progress and maybe present some information at the monthly staff meeting so that staff are able to see that it is something that we're dedicated to and we feel that needs to be done to truly make a valiant effort in an attempt to fix the issue of not always utilizing proper protective equipment and standard precautions. One of the ethical challenges that would be easily noticed would be speaking with coworkers in uncomfortable situations, especially those that may be in a higher position than you, such as physicians or mid-level providers, something along those lines. It may make certain nurses feel uncomfortable and uneasy, and those receiving the feedback or the constructive criticism would have to be able to respond well to it and to maintain a respectful work environment. Attached to this slide is my reference list that I utilized for my statistics and my comments and my evidence-based practice recommendations within this PowerPoint. Thank you for taking the time to watch my PowerPoint and to listen to it. I apologize for my baby in the background that is rather needy and vocal about it, but hopefully we will resolve our cold soon and we will be back to where we need to be. I hope that all of you have a great week and that you just continue to remain faithful and stay focused. We're halfway through the semester and we can definitely do it, you guys.